You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, we're talking about no more dentures. How you can get a fixed set of teeth in just a few appointments. In fact, with 2, 4, or 6 dental implants, you could get something that either snaps in and snaps out or a full arch, a fixed set of teeth. With us, we have an expert on the topic. He has been focusing on dental implants and doing dental implants to secure denture or help denture wearers for the last 20 years. Dr. Papneja, welcome to the program.
Thank you, Randy.
Now, we've had you on the program before.
Right.
So thank you. I think it was 4 years ago.
4 years ago.
And what's changed, by the way, in those 4 years?
In 4 years now, we are utilizing a lot more CT scan technology.
Okay.
You can see where the bone is, so patients can have an easier time with the surgery. We can plan better, and when we don't have to open the gum that much, we can do the
surgery. So it doesn't hurt as much?
It doesn't hurt that much. People go back to work next days.
Really?
And they take just the Motrin for the pain management.
So just Motrin and
yeah.
They seem to be fine. Now, for people that don't know you, and I know you don't like to brag about yourself, and people need to know it's a real interview. I'm not siding with you on this. I'm just asking the questions. But you have a very large, one of the largest places for sure, I guess, in Brampton and in Toronto. 10 doctors that work under you,
right.
Dentists, specialists, periodontists, orthodontists, endodontists. Those are the root canal guys. Is that right?
Yeah.
And so you do everything. So tell us about your practice.
Yeah, it's under one roof. We do provide all type of dentistry. We have general anesthesia also available, anesthetists. We can put children to sleep, adult to sleep, and do all the work. People who are very nervous. Children,
so that works right there. You have
it works right in the office.
Like IV sedation.
IV sedation, yeah.
And so what are who's your typical patient, I should say? Starting from the smallest things to dental implants.
Yeah, we have a patient we are general dentists, provide all the dentistry. So we have a patient, children, who can basically, we can provide all the children dentistry, and then all cross section of adult, including the patients who are 87, 90-year-old.
Is that right? So you have 90-year-old patients going in there, and what are they having done, by the way?
We have just done implants for 87-year-old patient.
A dental implant?
Dental implant. We placed 9 implants, and he was extremely happy with the quality of life. He can taste the food, he can chew the food, he laughs a lot, and he always is very thankful.
So like 9 implants for upper and lower?
Lower, yeah.
Like a fixed set of teeth, or they snap in,
snap in and snap out, yeah.
You're not too old at 87?
No, not at all.
Really? I mean, aren't they more likely to fall out, the dental implants?
No, they work beautifully.
So the bone can grab onto
is strong, and there's no risk of falling off.
But it must be more painful if you're older.
No, not at all.
Really?
Bone doesn't have a feeling. Just like nail, hair, you can cut it.
Okay.
There's no feeling. Only little incision you make on the gum. That's why people go back to work next day. Take just Motrin, and that's all it is.
Now, 20 years ago,
yeah,
I guess things were much different. And I've done some research on the topic.
Right.
But why is it what used to take you guys like 9 months now can happen in just a couple of days or a few visits?
Mostly,
what's the biggest changes?
Mostly the philosophy is changed with new research and the understanding. Implant surfaces are different, and we can put implant and the teeth same day these days.
Same day?
Same day.
Somebody walks in, missing a tooth.
Right.
They walk out with a tooth.
They have an implant, they have a tooth on it, fixed. And we can do all in the same day. So there's a new understanding, a new philosophy.
Is that right? Now, how big of a problem? And let's say, I know you're a suburb of Toronto.
Right.
Is that correct?
Yeah.
Let's say using Toronto, would you say there's thousands of people with an upper or lower denture?
Yes.
Tens of thousands?
There are tens of thousands of people.
With
City is 6 million population, tens and thousands.
Like hundreds of thousands of people with a denture,
with
upper
a
or
denture,
lower.
upper and lower, loose fitting dentures, and they do not know that this treatment is available.
Why? Why don't they know?
Because they don't visit dentists regularly.
Oh, so they don't go to the dentist.
Right. So they have no idea this option is available, which can enhance the quality of their life tremendously. Because right now they can't smile, they can't chew their food. When they're eating it, dentures make noise.
Do they tell you this on the consults?
That's what they say. They can't taste the food. We had other day one patient, he's a chef. So he used to have a ill-fitting upper denture, so he couldn't taste the food.
Oh, because the palate is covered?
Is covered.
Okay.
So that's the only reason he came. We put 4 implant, snap in and snap out, and he's so thankful that he can taste now salt, sugar, and he doesn't have to take the denture out. He's so happy.
Now, what about this though? What if somebody, knowing you're going to come on the show,
Right.
I talked to people, but what if you've been in dentures for 20 or 30 years? Isn't it true you don't have enough bone? Or is that not true?
It's not true. These days, you can do CT scan, you can find usually there's enough bone to place implant. Through CT scan, we can identify the area.
So would you say it's rare that somebody comes in their 80s or late 70s, which is young today,
right.
that does not have enough bone?
Yeah,
one way or another, you usually make them candidates?
We make them candidate, yeah. CT scan technology allows basically to find the areas where there's a bone. Otherwise, the bone graft can be done. But no more hip bone graft and other surgical procedure. Like in the beginning years, people used to harvest bone from the hip area and put in the jawbone. Those procedures generally not necessary anymore.
But where you are,
right.
Is it common though that somebody does it the way you do it, where the dentist does the surgery and he also puts the crown on top or the teeth on top?
Most of the time, the one dentist would do the surgery, other will put the crown. Very few.
So it's 2 different doctors.
Two different doctors.
Same as here. Okay.
Whereas I do everything start to finish. So that's more convenient to the patient. We can answer all their questions, satisfy their needs. So finally, they are very happy.
And pain is not something they really complain about? Because it
Not
seems
at
very
all.
painful.
No, that's what the thought is. But Randy, the bone doesn't have feeling. There's no nerve in the bone. It's like a nail in the hair.
Yeah.
You can cut it. So all the pain is coming from little small incision on the gum, which if it is a clean surgical incision, there's no pain. You can go back to work next day. You just take Motrin for pain.
So you use like surgical guides? I've looked at some of the videos, guides?
Yes, some cases we use the surgical guide where one doesn't have to make any incision. Everything is planned through computers, and all surgery can be done through those guides.
Okay, now let's talk a little bit about then moving on to the options for denture wearers. Okay, and on the consult, so they come in, a person with an upper or lower denture comes in. What do they ask you every time? What does that consult day look like or sound like? And what do they ask you?
Typically, they're concerned about pain. Is there going to be a lot of pain? So we always tell them there's no pain. Go back to work next day. You don't need to take time off for it. You just manage with the Motrin. Other is the cost. They think if we are putting 12 teeth in the upper jaw,
12?
Right.
Okay.
Or the lower jaw, you need 12 implants. That is not the case. You're putting 2, 4, 6 implants and putting 12 teeth in each jaw.
Mm-hmm.
So that way there's a less number of the implants.
Because you say as little as 4 implants could give them a full arch of teeth.
Full arch of teeth, yeah.
So the perception is they need an implant for every tooth.
For every tooth, yeah.
Not the case.
That's not the case. Yeah.
And what are other questions they want to know? Okay, so they ask about pain. They think it costs more than it really does.
Right.
What else do they ask?
Will they be without teeth for how many days? But that's not the case. They walk out with the teeth.
With a set of teeth. So they're never without teeth.
But they are never without teeth.
How soon can they eat, by the way?
Initially,
I mean, if everything goes right. Let's say if everything goes right.
Initially, we start with the soft diet. And once the healing is done, they can start to eat broccoli, then steak and fruit and vegetable. And they go back to eating whatever they feel.
Do they ever tell you what they're eating? Like they come in and they say, "Doctor, can I eat it?" I mean, are they afraid at the beginning?
In the beginning, they're afraid.
Like what do they say? Do they say, "Can I eat an apple or broccoli?" Or
Right. In the beginning, because since they were wearing the dentures, so they stop eating the food which is harder to chew, all the fibrous food.
Okay.
So now they can eat. They can eat everything: raw vegetable, apple, broccoli, steak, corn, and they just love it. They eat more, they laugh more, and they enjoy the life. And people wonder what has changed with them.
Really?
Yeah.
Now a dentist, and respectfully I say, you probably think teeth are pretty important, right?
Right.
That the smile's more important, very
Right.
important.
Right.
How important do you think the smile is? Because you see a lot of these denture wearers don't like the look of their denture. They don't smile because of it. How important is the smile in your
I
opinion?
give you an example. The one of patient I just did upper and lower fixed teeth. That is a 50-year-old gentleman, CEO of the company, and he was not happy with the smile. So in the meetings, he would not that much smile when meeting the people. When he will do presentation, he would not be smiling. And when we placed the fixed teeth in his mouth, when he looked at the mirror, he had tears in his eyes.
Really?
What a beautiful smile I have. And after the follow-up, few months after that, he says, Terry, that is the best thing I have done. I should have done it sooner. I smile more, laugh more, eat more. I'm always going out in the restaurants and I'm enjoying the life.
Is that right? And is that do most people say I should have done this years ago?
Absolutely. That's what the most common expression. It should have been done long time ago. Why did they wait?
Now, one of the things you told me on the phone, you said that people have been told elsewhere,
Right.
at other doctors' offices, that they didn't have enough bone.
Right.
But you were able to do the implants anyway.
Right.
Is that true? That happens?
Only
And if it happens, why is it happening?
once you utilize CT scan technology, then you can see where the bone is. Without CT scan, if the ridge looks thinner, you think there's not enough bone.
Okay.
But that allows you to see the areas where you can do it. And plus, these days you can put fixed teeth with a 4 implant. So we can use
4 implants on a fixed set of teeth.
fixed set of
Okay.
teeth. So we can use angled abutment to cover more range of the jawbone.
Okay.
So that way
You brought that example. In the green room, you kind of, I think I know what you're talking
Right.
about. That means the rear dental implants are angled.
So that way, the half of the arch is covered. You're
Let me see
putting
this.
2 at the
They
front.
won't be able to see this on TV.
Right.
You brought some animation, so we'll drop that in.
Right.
But, so just 4 implants and they get a whole arch of teeth.
Whole arch of the teeth.
And they can eat whatever.
They can eat
Corn on the cob?
Yeah, yeah,
Really?
absolutely. Yeah.
You know, on YouTube,
Yeah,
I see people, they have the procedure and then they buy an apple right after the surgery.
right.
You don't recommend that though. But is that true? You can do that if...
Person can do it, but usually we want them to wait that the healing take care of it first, and then he can eat it.
Okay. Now, what if somebody watching this has osteoporosis,
Right.
things like that? Are they still able to do this? Are they still candidates?
Patient with the osteoporosis, that if you're not taking Fosamax pills for a long time, yes,
Fosamax, you said? Okay.
then you can do it. There's no problem. Osteoporosis is still, implant would work for you. But if you're on the medication for a long time, one has to stop the medication for a few months and then can be done.
So what is your oldest patient you've ever had that has done this?
87-year-old.
87. Now, what about your friends? What's the oldest you've ever heard? Because
I heard patient as old as 100 years old.
Really? Now,
getting
why
it
would they
done.
want to do that, though?
It's a quality of life. You can chew the food.
Okay.
Unless you have fiber in the diet, you live on Metamucil. So people want to
Good
get
point.
out of it. Yeah. And you need to, in order body to function well, you need to eat well. And it gives, and plus there's a joy, the taste in eating. They want to have fun in life.
I guess we take it for granted by, I guess if we have our teeth. Okay, so let's start from the basic. Okay, so they go in on the consult.
Right.
How soon, the denture wearer goes to you, how soon before you say, yes, we could do this for you? That means you'd qualify, you'd be a candidate to do this.
Within 3 days, we will have CT scan, all the information, and we can decide. And within 7 to 10 days, we can give you fixed teeth.
A fixed set of teeth.
Yeah.
So somebody's watching this, okay?
Right.
And I'm going to talk in a perfect world situation, okay?
Right.
If they're, let's say, 78 years old,
Right.
from the time they go in,
Right.
if they called today, let's say they go in today for the consult, how many days from now could they have a full set of teeth that are fixed in their
7 to
mouth?
10 days, they can have a full set of
That's a
teeth.
fast turnaround.
Yeah, that's a fast turnaround. Because CT scan takes a couple of days to done.
Okay.
And after that, it's a matter of preparing all and creating
How
a
good
surgery.
do these teeth, because it's kind of like an over denture, what do you call it? It's like a denture on top of dental implants? Help me understand. What is it?
Basically, these are the modified dentures. Basically, you take away the palate. So there's a very thin,
Like this?
like this.
Okay.
There's no palate, and beautiful looking upset of teeth.
So they look real.
They look
Because I feel like I could spot dentures.
right.
And so these, they look like cosmetic.
Yeah.
So color, the way they're going to look, does the patient get to pick their smile ahead of time?
Absolutely. One of my patients brought in a picture of Elvis Presley. He said, "This is what I want in my final teeth," and we created that. And again, that gentleman had tears in eyes.
Is that right?
Yeah.
So they look at themselves in the mirror and they get emotional sometimes.
They got emotional.
Is it mostly women? I thought it seems like it would be mostly women
Right.
because men put things off, right?
Right.
Is it mostly women that do this? Like, what's the
Mostly
ratio?
women.
What's the percentage in your practice?
For the people who will choose to do,
Yeah, that are getting dental implants right now.
both men and women, 50-50%. That's what the patient ratio is, because all the working people, when they go out, they want to meet people, they want to
Doing
smile.
a presentation or whatever.
They're doing presentation. One patient, says he sings a lot more and talks faster now after getting the fixed set of teeth, because he's not worried about the denture will fall out and it will be loose.
Now, are you doing in your practice? So are you doing more? I've had dentists tell me this. They say, Randy, it's very hard to reach the denture wearer
Right.
because they don't go to the dentist anymore, right?
Right.
That we do a lot. They'll tell me they do a lot of single tooth implants or 3 and 4 implants. Do you find it that way too? It's tough to reach your message to the denture wearer.
Yes, there's more of the other people who are missing 1 or 2 teeth, like or 3-4 teeth, due to sports injury and other reasons, because they are visiting regularly dentists, they are more likely to get it done sooner.
Okay.
Denture wearers don't visit dentists, so they are not aware of it. This option is available,
Okay.
so they don't get it. But once they know it, they have the information, more likely they get it done.
Now, what do you say to? Is there such a thing you think then? Because I know a few denture wearers. They never complain to me about their dentures, right? Is there such thing as a happy denture wearer?
Randy, that's, you don't know, but they tell us. There is nobody's
Good
happy
point. I
with
guess
their
they're not going to
denture.
tell me, right?
Right. And they just learn to live with it. They just adapt. It's just like somebody goes into the jail. They are miserable for 3 months in jail, but then they learn to live with it, and they are happy there.
Okay. So you equate that. So people that are wearing dentures just
Right.
adapt.
They adapt.
But have you ever had anybody that says, I should have just kept my denture?
Not at all.
I mean, 20 years you've been doing this.
Not at all. They're so appreciative. It's a life-changing experience. Before, they could not eat, they could not laugh. They were afraid of going to restaurant because the people will hear the denture noise while they're chewing the food.
Okay, I've heard that, like clicking.
The taste of the food was not there. No fiber in the diet.
Okay, so let's begin then with the least expensive option, the lowest cost option for denture wearers to, I guess, the best that they have available to them.
The lowest cost is you can put 2 implants. You can in and out, snap in.
A full arch of teeth.
Full arch of
Just
teeth.
2 implants.
2 implants. And those 2 implants can hold the denture so it's not moving.
So
while
no
you're
adhesive
chewing.
at all?
No adhesive at all. Otherwise, bottom denture floats in the mouth just like the boat in the water. Whenever you're moving the tongue, the denture is moving. When you want to talk, the denture is moving. When you want to eat, the denture is moving. Now it is anchored, so it doesn't move. But the better option is also available. You can put 4 implants on the bottom. That is again snap in, snap out.
Is that your
That's-
preference? Is that what you'd rather they do?
Right. That's much more stable there. It stays there better. Then there's a next option is you can put a fixed teeth
Okay.
where you don't have to take the teeth out at night time.
Wasn't that what everybody wants, though?
Everybody loves the fixed teeth. That's what nature has given us. We are so adapted to use. Then you're not embarrassed to take them out at night time.
Especially people are dating. I mean, now
Yeah.
they're dating 70s, 80s even. I was on a cruise couple of 80-year-olds met on a online dating site.
Right.
So I guess it's, you don't want to have a denture, I guess, if you're dating.
You can't kiss. So you need some teeth which are fixed. That way you're comfortable and you're not embarrassed about them.
So it's a big, would you say, a boost to their self-esteem? Do you
Absolutely.
see differences? Do they tell you that?
We see the differences and they appreciate the work what we do for them. They're so happy, delighted.
Really?
Yeah.
They ever write you cards or?
Yeah, we get the written, we get verbal praises, and they are very pleased. They send us their friends for us to provide them the similar treatment.
So denture wearers, people that are wearing dentures, I'm sure that they have other friends that are denture wearers, so it's a big word of mouth?
A big
Is that a
word of-
big
Yeah,
thing
that's
you get?
a big referral. Big referral source for us, where they will talk to their friends. Even friends are just curious what has changed in this person's life. They're eating more, they're laughing, and there's a better self-esteem, better projection of life. They're going out more. So they're curious, and that's how the whole thing is start. And then they send their friends to us.
Now, you told me this, because I looked at the old tape
Right.
of, I interviewed you, I think about 4 years ago, and you said, out of all of areas of dentistry, from smile makeovers, cosmetic, orthodontics, pulling out wisdom teeth, whatever, that this is the happiest group
Yeah.
of patients.
This
Is that right?
That's true. This is the happier group of patients because they never thought they could have such stable teeth. They can chew, they can get back to their original life when they used to have their teeth. Because once you have a fixed set of teeth, you have a 90% chewing ability. You can eat anything you want. You are not embarrassed. They are not making noise when you're talking. You can sing, and you can talk fast without worrying about denture will fall out.
I had a doctor on my show one time said that denture wearers, and I don't know whether I believe that, or I don't know. I'm always skeptical,
Yeah.
right? But he said that they're not really chewing their food. They're not tearing their food. They're just kind of rubbing it together like a cow.
Yeah, that's true.
Is that right with a
Yeah.
denture wearer?
Because the dentures are moving. Because there's a movement, there's nothing is anchored.
So nothing.
So they pretend chewing. There's always a
So they
pretension.
also think they're chewing.
They also think they're chewing, but it's always a pretension. Actual
Interesting.
chewing is not taking place, and that's why they develop a lot of GI problems also, gastrointestinal problem, and they have to
Interesting.
live on Metamucil for the fiber diet because they can't chew.
I eat fast sometimes, not all the time. But I had a girlfriend at the time who used to say, because I eat so fast, she said, there's no teeth in your stomach,
Right.
Randy.
Uh-huh.
That's why you have to chew your food.
You have to chew your food.
And I always think of that line. So that's why denture wearers aren't
Yeah.
chewing. So
And they're eating mostly carbohydrate diet, which is raising the blood sugar level, and then it's harder to manage their
Interesting.
diabetes on top of that. Yeah.
So do people lose weight or gain weight after this? What's your experience?
Generally, they lose weight because they're eating less carbohydrate, more fiber, more protein. So their weight is a little less after having the fixed teeth.
One of the things that you said, and we were talking off camera in the green room, is that, because I still am always skeptical. I said, but if it's so good, why aren't all the denture wearers doing it? And you say, one of the things you pointed out is that because they went through a lot before they became a denture wearer, and the last thing they want to do is see a dentist. So elaborate on that.
Typically, patient, they have root canal done, extractions done, abscesses in the teeth, advanced gum disease. So there's a lot of pain and suffering they've been through. So the last thing, they are happy initially to take the teeth out, set up the denture, so that way there's no more pain and all.
Okay,
going.
good point.
But they don't realize that they have lost the chewing ability. Now denture gives you only 20% of the chewing ability, and you can't eat any food, any hard food, steak, corn, your apple, raw vegetable, nothing those sort of things. So they'll end up having more carbohydrate diet, and that basically is difficult for their health in the long run.
What's the most gratifying thing for you about what you do when it comes to these patients?
When we can change the quality of life for patient, and patient says that how it has tremendously improved the quality of life. They can socialize more, they go out more.
So you still enjoy it?
They still enjoy.
Because I asked you before we started. I said, "Are
Yeah.
you ever going to retire?" And you said, "I don't know. I don't think so." Right?
Yeah, I don't think so.
Because
That's
you,
what
you
it is.
still have fun at this.
I still a lot of fun with it. Providing the quality of life to people is a greater satisfaction.
Good for you. You know, we should mention, and we didn't plan this, but I mean, you help in a lot of charities, helping children, feeding children, or educating children?
Oh,
I
yeah,
should say.
yeah.
Because on your website.
Right. I started one of the charity in Canada. Like I'm part of the bigger international charities called Aim for Seva, where we educate poor children. These children come from the remote villages of India where there are no road, no electricity, no schools. So we bring them to the bigger town and we provide them all the facilities, home away from home, and they go to regular school and we educate and we provide them everything free. Toronto, so far, we have
On your website it says about 300 children.
700 children.
700 children.
From Toronto we support 700 children. So far I have raised $3 million in last 10 years.
Good. Good. Well, good for you. Well, look, there's obviously a lot to know about you, Dr.
Yeah.
Papneja, and always a pleasure to have you on the show. We're out of time. So if somebody's watching this, they're still afraid, they're still skeptical, what do you say to them? Come in,
Come
get a
and see
consultation.
us, free consultation. We will take some necessary x-rays, give you option, give you information, then you can decide from there.
All right. Thank you so much for coming on the program. Always a pleasure.
Thank you, Randy.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you could go to our website at wellnesshour.com. You could put in Toronto dental implants, you'll find, or if you could spell Dr. Papneja, you can also do a search there and you'll find him there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.